Hello, my beautiful hospice family. Good morning, good evening, wherever you are in the world. Welcome back to DunsHospice. My name is Nurse Dawn, and I am your hospice registered nurse. And here at DunsHospice, my mission, my goal is to educate the families, the caregivers, and even some of the healthcare professionals so that we can make informed decisions for our loved ones during end of life care. Today's topic is one that deserves compassion, understanding, and truth. The title is When Does HIV Qualify for Hospice Care? Now, before I begin, my beautiful hospice family, I want to say something that is incredibly important. You see, having HIV is not something to be ashamed of. It is a medical condition, not a moral judgment. Millions of people around the world live full, meaningful lives with HIV because of modern medicine, you see. Many people with HIV work with us, they raise families, they travel, they build careers and lives for decades after the diagnosis. This video, I want to make it clear, it is not about creating fear. Rather, it is about education. Because I believe and know that education replaces fear with understanding. HIV stands for Human Immunodeficiency Virus. It attacks the body's immune system, especially the CD4 cells, which helps us to fight infections. Without treatment, HIV can gradually weaken the immune system. However, the good news, my hospice family, is that today we have medications called antiretroviral therapy or ART. And these medications have completely changed the outlook for people living with HIV. Many individuals who currently take their medications consistently have achieved what is called an undetectable viral load. When someone maintains an undetectable viral load through treatment, this means that they do not sexually transmit HIV to their partners. And this is often summarized as U equals U, meaning undetectable equals untransmittable. And that is one of the greatest achievements today in modern medicine. Now, regarding hospice care, I want us to understand that a diagnosis of HIV alone does not qualify someone for hospice care. Hospice is based on prognosis, not diagnosis. Okay? And generally speaking, I want us to understand that hospice is appropriate when the doctor believes that someone has a life expectancy of 6 months or less if the illness follows its expected course. And many people with HIV never need hospice because treatment is so effective. Now, hospice becomes appropriate when HIV has advanced significantly or when there are serious complications that are currently being developed despite of treatment, despite of these medications giving. The following signs and symptoms might be considered when someone has advanced HIV disease. Okay, and these complications are things such as significant decline despite medical treatment, severe weight loss and muscle wasting, frequent hospitalization, serious infections. You see, certain advanced cancers that are associated with immune suppression, severe neurological decline, progressive dementia that's related to HIV, recurrent infections that the body can no longer effectively fight. You see, and that is when the patient chooses comfort focus rather than curative. They focus on quality versus quantity, you see? And the patient chooses comfort focused care rather than an aggressive medical treatment. Some of the other factors that hospice nurses looks at is, can the person eat? Can they walk? Are they spending the majority of the day in bed? You see? And are the treatments still helping? And these are some of the questions that will help to determine if it's time for hospice care. I want to make it clear and I want us to understand that hospice is not about giving up. Hospice is changing the goal. You see, instead of trying to cure the illness, the hospice team, focuses on comfort. We focus on dignity. We focus on quality of life. For someone living with advanced HIV, hospice can provide you with the following such as pain management, symptom control, emotional support, spiritual care, nursing visits, social worker, a home health aide, medical equipment, medications that are related to your diagnosis, and also bereavement support for your loved ones. Hospice also supports the family. It's not only for the patient, but it's also for the whole family. You see, no one should have to walk this journey alone. Now, I would like to take a moment to talk about the stigma that surrounds HIV. One of the greatest challenges surrounding HIV in my husband's family, it's not the virus itself, you see. It is the stigma. It is how society perceives somebody with HIV. You see, people hide. People often suffer in silence. People fear being judged. But know that shame has never healed anyone. Compassion does, education does, support does. So if you are living with HIV, please know this, that know and believe you deserve respect. You deserve health care. You deserve love, dignity. You are not defined by your diagnosis. We as a society should continue supporting research, improving access to treatment, you see, and advocating for the day when we could have a cure for HIV. Until then, my husband's family, let's replace judgment with understanding. It's also very important, my husband's family, for us to have honest conversations, you see, because education also means talking honestly about prevention. Protect yourself and your partner is an act of love and responsibility. Having safe sex, getting regular HIV testings, and of course, being open with your sexual partners, all of the above will help to reduce transmission and also support healthier relationships. Know that if you are living with HIV and you currently are in a relationship, honest conversations with your partner is essential. You see, they build trust and allow both people to make informed decisions together regarding their lives. For people at higher risk of acquiring HIV, medications such as PrEP, pre-exposure prophylaxis, these medications can greatly reduce the risk of infections when taken as prescribed. And people who may have been recently exposed to HIV, they should seek medical care immediately because there are certain medications called PEP, post exposure prophylaxis. These medications can help prevent infection if started within the recommended time window. You see, my hospice family, knowledge can save lives. Honesty protects relationships, and early treatments can also change lives. I pray that today's video helped answer the important question of when does HIV qualify for hospice care? When does somebody living with HIV would qualify to be under hospice care? All right. Please be certain to ask me any questions you have in the comments. And remember that HIV alone does not mean that somebody needs hospice. Okay. I want us to really remember that and know this. Just because you have HIV, that does not mean you need hospice. Hospice is considered when advanced illnesses and overall decline suggest that the focus should shift towards comfort rather than quality, rather than aggressive treatment. And most importantly, my hospice family, I want us to continue replacing fear with education. Let us replace shame with compassion. Let us support one another with kindness and understanding. If this video was helpful, please be sure to like it, subscribe, become part of the family, and share it with someone you know who may benefit from this information. Because by sharing this reliable educational video, you help families make informed decisions. And you could also be part of the process in terms of helping to reduce the stigma surrounding serious illnesses. Thank you, my hospice family, for spending this time with me. As always, take care of yourself and each other. And I'll see you in the next video. Take care. God bless.